After surgery for a breast, whatever might be the surgery, either it is a lumpectomy or we are removing the complete breast. People usually ask whether because can we get a new breast or how to reconstruct our normal shape. There are different options to do that. If it is only lumpectomy, what will happen? There is a gap in this part of this thing. What we do, something called displacement or replacement surgery, where we shift the normal tissue from here and we replace here. I also called oncoplastic surgery. This is we are doing for almost all cases which we are doing breast conservative surgery, wherein we mobilize the local fat and then we fill the area so that final end result it looks like as good as normal breast. This is about when we are doing lumpectomy. There are conditions where we are completely removing the breast. Usually how the appears, this will be the breast and this will be, we'll put stitches here, right? This how it looks. So people who are young or who are like cosmetically aware or psychologically also we want to reconstruct the breast. So there are different options how to reconstruct the breast. That we can do, when to do that also, like we can do just immediately after we remove the breast, we can reconstruct this part, like we can do reconstruction, or maybe after we complete every treatment, maybe after a year of time, then also we can reconstruct the breast later time. So what type of reconstruction? Reconstruction type, there are some very simple methods like cuffed bras will be there, like we can use a cuffed bra so the outside look cosmetically it appears like normal to opposite breast. Other things called silicone implants we can do, wherein this, for example, so this is the normal breast, this is the bone wall. So after removal this surgery is done, only the skin is remaining like this. We can place an implant in this section, this is called silicone implant, and we can expand this so that it will look something like this, or it has a good ptosis compared to normal breast. This is about silicone implant. Second thing is, other than silicone implants, what we do is surgeries which is called flap surgery, or normal body tissue is replaced here where the breast has been removed. The different types of flaps are there, and what type of surgery we choose depends on the size of the normal opposite breast. If, for example, if the breast size is very small and we have removed this breast, so we need a small tissue to repair, we do something called LD flap, wherein we can reconstruct the breast. The flaps, that volume is less, that means the bulkness or the size is less, so we can, for a smaller breast we can do that, so that both the breasts look similar. Then for bulky breasts or the breast size is more, we have something called tram flap, wherein we utilize the fat and skin from the abdomen and then we replace here in the position of the normal breast. So, and then we reconstruct nipple and areola also. That there are some after tram, when we reconstruct nipple and areola, 90 to 95% it looks similar to the opposite breast. So this will avoid our psychological issues and the cosmetic issues.